Well, the winter weather can be a fun time for outdoor activities, but it can also pose some problems. Today, we thought we would talk with an expert on this subject to let us know how to stay safe when we're outdoors doing anything. I'm pleased to be joined by Dr. Kira Weaver, who is the new Emergency Department Medical Director for Lehigh Valley Hospital, Hazleton. First of all, congratulations on your promotion, and thank you for joining us today.
Anytime, thank you.
Now, I know that you must see a lot in the emergency room of people coming in with injuries from the winter. So what are the main things that you do see?
Okay, so in the winter, we do see an increase in falls. Okay, so we do see that because of ice being on sidewalks, steps, roadways. Also can contribute to like increase in car accidents, like poor weather, such as snow and ice. Can make that, more common than just because of like poor visibility or the road conditions. Some other, injuries that we'll see associated with winter. We have, people working with snow blowers, not turning them off can lead to like finger or hand injuries. We also have winter sports. So you see, like some more orthopedic injuries, basically like for skiing and snowboarding. Even sledding in the backyard can, pose to injury if you're not cautious. And then, one of the things we do see, which is, related to trauma a little bit, maybe people that are found down in the snow, intoxicated, or, people that might participate in ice fishing on thin ice, hypothermia. So we do see hypothermic injury, states that may also contribute to trauma that actually kind of falls under the trauma category.
Now, when you talk about injuries, like if we fall, what are the biggest concerns? I would think breaking something and possibly hitting our head. Are they things that we should really be concerned about?
Right. So yeah, broken bones, of course, internal bleeding, some of the most severe could be related to the head. So, we do want to be cautious with patients if they do have head injuries or potential head injuries. Tricky part is sometimes concussions and head injuries can look very similar. Concussions is a clinical diagnosis based on symptoms, and the CAT scan doesn't necessarily show bleeding, or injury. However, it's different than when we talk about a traumatic brain injury in the sense of head bleeding or like a brain bleed, because of the fact that there's actual blood. Sometimes, someone may have a skull fracture, so it's a little bit more complex. But both can present with like headaches, nausea, vomiting, dizziness, trouble focusing, confusion, trouble walking, changes in speech. And so that's what makes it fairly tricky.
And then if we're outside in the cold too, we have to make sure we're covered properly so that we don't get frostbite. Do you see a lot of that?
We do see that. Good you brought that up, because we do see that in the department. When people aren't dressed appropriately for the cold, they're out for prolonged periods of time, whether some people, you walk more, than like drive or take public transportation, or maybe people, participate in winter sports or, enjoy hiking, things like that in the winter. So you do want to make sure that you're dressed appropriately for the conditions, especially if something would happen that you'd be out in the cold for a prolonged period of time. We recommend, basically you want to wear like looser base layers that provide good insulation, and then have coats and pants and gloves or mittens, face coverings. I think about covering your ears, your nose, your fingers, your toes, things where you lose a lot of heat very quickly. And those are some of the most prone areas for frostbite.
Great information, great advice on all levels for anybody going outdoors for any reason, because something could happen in a split second. So we want to make sure that we pay attention to what's happening and seek the professionals' help if we need it. Thank you so much for talking with us today.
No problem, anytime.